You're very welcome back to Ireland AM. Now, a new strain of influenza is spreading rapidly across the country, placing significant pressure on the healthcare system. And joining us now to talk about the outbreak is GP Brian King.
Brian, we appreciate you being here. But first, we're getting the latest update on the flu outbreak from the chair of the IMO GP Committee, Dr. Tig Crowley. Tig, thank you so much for joining us this morning. There's 657 patients are the latest figures that we have in hospital, which is up 58% since the end of November. 2,944 cases of flu notified in the state last week. We're not at peak flu season, though, are we?
No, we're not. And in some ways, we're only starting. It'll probably peak the week after Christmas, they're suspecting. In general practice, there's been a sort of a threefold increase in the week of cases. And then, as you said there, sort of doubling in the last week of hospital admissions. So obviously flu is one of those illnesses that, you know, once it starts, it really spreads quite quickly. So we're obviously encouraging flu vaccination is really important. If you hadn't flu vaccines, just encourage people to consider it. Many people have already been in, particularly in the over 60 community. But obviously in younger kids, we're encouraging, if you haven't had the flu, to go get a flu vaccine this season.
And Tig, what are the projections for the next few weeks? Are we going to see a surge in hospitalisations, or what's your predictions?
So that's the problem with the flu. It's, you know, sometimes people get mixed up with colds and flus. Flus can be very serious, apart from very debilitating and, you know, aches and pains, shivers, feeling unwell. It happens very quickly as opposed to a cold. And some people with the flu get quite sick and end up needing, first of all, GP services, but then secondly, they end up going into hospital. And I suppose this is the danger then, apart from themselves being sick, they're in hospital, and then that means routine hospital procedures have to be cancelled to cope with the overload.
Tig, I know that we've got restrictions in hospitals across the country, some limiting visitors to one person, some banning visitors entirely. They're asking people to wear masks when they're coming into hospitals. What else should we be doing?
Well, I suppose the first thing is, if you have the flu, you know, not to be circulating. I mean, the first couple of days, you won't feel like circulating with anyone, but as you're getting better, you're going to start feeling that's a bit better and to move out amongst the community. Obviously, we're back to some of the procedures that your watchers would have had during COVID, which, you know, the use of tissues, the hand hygiene, you know, if you're coughing, to keep the cough away from people.
Okay, Brian, thank you very much for Tig, thank you very much for joining us. Brian, you're a GP. I mean, what are you seeing coming through your doors now at the moment?
I suppose in the last 2 weeks we've seen a big surge, definitely in people with flu-like symptoms. And as Tig kind of alluded to there, it's not just a simple head cold, which has kind of been coming on for a couple of days. You know, with a head cold, you kind of say it's runny nose, scratchy throat for a couple of days. These are people who kind of were well on Thursday, got sick Thursday night, Friday, are very, very sick and unwell. So what are we seeing? We're seeing a lot of children, we're seeing a lot of kind of people over 60, 65, and people with an underlying condition such as maybe asthma or COPD or heart disease or diabetes, who are a little bit more vulnerable. But we are seeing usually healthy young people in their 20s and 30s coming in as well. So seeing a lot of children with high temperatures, not eating, not drinking much, very lethargic, very kind of parents saying, look, he won't eat his breakfast, he hasn't drank much today, he's quite listless at times. I give him Calpol Nurofen, the temperature comes down and it goes back up about 2-3 hours later. So, you know, flu doesn't necessarily always have to be respiratory symptoms or chest symptoms. Quite often it can be pains and aches all over, muscle-wise. It can be in younger people, sometimes nausea and vomiting, or just generally just malaise, as we call it in medicine, like being hit by a bus. Somebody described it to me once.
So what should we be doing? Like, if you've got a baby at home and you're terrified, but you're hearing we're at max capacity in hospital and, oh God, don't come in because it's spreading inside in hospital, you're kind of going, what do I do? Well,
obviously, you know, first things and the simple things we can all do, and I think as Tig said there, if you have symptoms, isolate. It's kind of back to COVID times again. High temperatures, you know, paracetamol, ibuprofen, so in kids' case, Nurofen, Calpol. Keeping them hydrated is really important. Whatever about them not eating, but make sure they're drinking, okay? And make sure some of those fluids are sugary or electrolyte rich. So sometimes stuff like oral rehydration, deorolite solutions, sometimes just juice, kind of Mywadi, things like that. Keeping them hydrated. If they're a baby, keeping an eye on the nappies. Are they still having wet nappies? A child who's tiring, who perhaps has respiratory symptoms or is just generally tired, difficult to rouse, temperature goes down with Calpol, Nurofen, but comes straight back up again 2 or 3 hours later, that child needs to be seen by somebody. So obviously your GP, your out-of-hours service, or indeed your A&E department.
I know when we had our son last year, it was around January time when RSV is rampant, and sometimes as a new parent, you think the minor things you're going to have to rush to the hospital. But I mean, what should parents be looking out for in terms of how serious this is, the influenza outbreak? I mean, should they want to avoid it if, as what you just mentioned there, unless there's serious signs here?
Yeah, I suppose look at it as well, if your child is between 2 and 17, they're entitled to a free flu vaccination as well. It's a nasal vaccination. I think I've spoke about it before here and showed it's not an injection, it's a nasal vaccine as well. So get your kid the flu vaccine. That'll be really important. Obviously, as a parent, it's trust your instincts. Parents are very, very intuitive. They know when their child is not well. They'll say something has changed here.
Brian, you work within the medical system all the time. You were a GP. You've said that you have seen a surge in the last 2 weeks. It's gone up 49%. GPs, 49% seen more flu cases in the last 2 weeks. This strain seems different. It seems to be stronger this year. Were the HSE, were we prepared for this?
Well, I don't want to comment for the HSE. Obviously, I don't work for them. But I suppose what the strain that's circulating at the moment is what's called H3N2. It's a slightly different variant than has been around the last few years. It has circulated in the past, but every year our immunity wanes from flu. The flu vaccine, the flu virus changes who it is, and that's why we vaccinate annually, to catch up with that. This year it's been a change so that perhaps we don't have natural immunity because it has been some years since this circulated. I believe as well the vaccine perhaps doesn't give full coverage to it,
right.
But at the same time I'm saying to people it's better than no vaccine. And what it will do is prevent you ending up in hospital. You may still get the flu, but you will be having a much milder dose of it and you won't need hospitalisation, and especially if you have an underlying health condition or indeed you're an at-risk population.
Yeah, it's not to minimise numbers because 9 people, 8 of them over 65, have died from this strain this year. They're not just a statistic, they're people's loved ones. Absolutely. But as you said, it is going to get worse. And we're kind of crippling under the strain right now.
So I suppose it's a kind of a little bit of a perfect storm. As Tig alluded to there, we're looking at probably a peak the week after Christmas. And we're coming into a 2-week period now where people will socialise together. And this is like back to COVID times. And I know people have a lot of fatigue from COVID and listening to the same thing. But these viruses, be they flu, COVID, RSV, they love close contact. They love people circulating indoors, in close contacts, and they're spread quite easily by coughs and sneezes and so on, and general close contact. So it's back to simple things like breaking the chain. Okay, if you do have symptoms, don't circulate. Obviously, if you've got sneezing, coughing into the elbow, wash your hands afterwards. It's the simple things like that, and get the vaccination that can break the chain here.
We want people to follow the practice of common sense with where we've come from and where we are now to avoid something more serious. If you have symptoms, don't go to parties.
Indeed. Or don't go to play dates. And I know it's very hard, and I'm not trying to be the Grinch at Christmas here or anything like that, but breaking the chain will stop the spread of this.
Okay.
Dr. Brian King, thank you so much for coming into us. And we had Dr. Tig Crowley with us as well, who's the chair of the GP committee for the Irish Medical Organisation. If you have been, what's going on in your life when it comes to the flu at the minute? 0896 111 111, because it really does seem to be an absolutely very heavy dose that people are getting this